So the subtypes of bronchiectasis, these are just for your knowledge. They are not important for Plab 1 exam. Just to give you an idea, there are three subtypes of bronchiectasis. This diagram will help you understand it a little bit. Normally, this is a normal bronchi. You can see in this diagram that the bronchi taper towards the end. This is what happens normally. But in case of bronchiectasis, due to permanent or irreversible dilatation of the bronchi, this tapering is diminished. So if this happens, this is known as cylindrical type of bronchiectasis, that the distal tapering of the bronchi is diminished due to dilatation of the bronchi. So the cylindrical type of bronchiectasis is the most common type. On second number is a cystic type, in which cysts are formed. You can see that these small cysts. It's important to understand these two types because if you understand this, then you will be able to understand the X-ray findings of bronchiectasis. One type is cylindrical and the other is cystic. So on X-ray, there will be tram line cysts like this, that two lines, two thick lines or two white lines, and in between these two lines there will be air. Similarly, ring-shaped cysts will also be seen on X-ray. Let me show you an X-ray of bronchiectasis. You can see in the upper lobe of this X-ray, you can see these cystic lesions, circular opaque lines, this one, and you can see the air that is present inside this circular line. So these are cystic lesions. You can see them throughout the upper lobe, this one, this one, this one, this one, and this one as well. So initially the diagnosis of bronchiectasis is made on chest X-ray. So chest X-ray is initial investigation which will show cystic lesion. These type of lesions are also known as air fluid levels. The white lines, they are fluid levels, and these black shadow, they are air. So air fluid levels or cysts you can see in this X-ray. Similarly, you can see in this diagram that this is a tram-line cyst, a straight line. One is this one and one is this one, and there's air in between these two lines. I hope the findings in this X-ray of bronchiectasis are clear to everyone. You can zoom the picture on your mobile and you can see cylindrical cyst or tram-line cysts on this X-ray.
So this one is for cystic or is it for cylindrical?
Cylindrical will be like this. Just focus on the cylindrical type, that a straight two lines, because of thickening of the bronchi, there will be two straight lines and in between will be air. And cyst will be like a circular structure, a round white line and air inside that white line. Let me show you again. You can see here that this is a round white line. So both cysts and cystic lesion and cylindrical lesions both are present in this X-ray. Mostly they are cystic lesions, because circular white lines which are surrounding the air. This one, this one, there are some smaller one as well here,
Right.
and only this one is a cylindrical type of cysts. One straight line here and one is here, and there's air in between.
Air in between. Yeah. Okay. This one.
So someone with suspected bronchiectasis, the initial investigation will be X-ray. X-ray in severe cases will show these cyst-like bronchi or tram-line cysts. So chest X-ray in advanced cases may show 1 to 2 centimeter cysts. So I have shown you the cysts which are a round structure, a round white line, and that was surrounding air, and also tram line opacities were also seen. Now let me show you ring opacities or Singut ring sign on HRCT. So the diagnosis of bronchiectasis is confirmed on HRCT, and this is an image of an HRCT. In this, you can see a more clear description. You can see that this is a tram line cyst, true straight line and dilated bronchi is present. Now, can you see this sign? This is dilated bronchi with thick bronchial walls, and here this structure, this structure, and this structure, and this structure, they are just like a ring. This is called Singut ring sign on HRCT. So Singut ring sign, tramline cysts or cystic opacities, they are the diagnostic of bronchiectasis. You can see this is a dilated bronchi, this one as well, this one too. You can see multiple dilated bronchi, and here you can appreciate the presence of Singut ring sign, and here is a tramline cyst. Is it clear, everyone? HRCT finding of bronchiectasis. So the diagnosis will be confirmed on high resolution CT scan of the chest. And after confirming the diagnosis, you will come towards management or treatment of bronchiectasis because there is excessive accumulation of the mucus. So our main focus will be on drainage of this mucus. So the drainage of this mucus can be done through inspiratory muscle training that are specific exercises for inspiratory muscles. So physical training can be done to drain this excessive mucus which is causing all the problem. Postural drainage can also be done, and if there is a in severe cases, antibiotics can be used in exacerbation, as well as long-term antibiotics can also be prescribed. Bronchodilators in selected cases can also be given. Immunization, Haemophilus influenza vaccination and pneumococcal vaccination can be done to prevent recurrent infection. And if the disease is localized, it is localized to one lobe or one segment or 1 to 2 segment of the lungs, then surgery can also be done. So physical training, postal drainage, antibiotics for exacerbation, as well as long-term antibiotics, and surgery in selected cases. What are those cases? The cases which has localized disease, in which the disease is limited to a limited area of the lung. What are the most common organisms that are found in patient with bronchiectasis? Pseudomonas, Klebsiella, Streptococcus, and Haemophilus influenza. The most common bacteria that is found in patient with bronchiectasis is Haemophilus influenza. Pseudomonas, Klebsiella, and Streptococcus pneumonia. They can also be found in patient with bronchiectasis. So this was all about bronchiectasis. Now, who will repeat the clinical features that are specific to bronchiectasis?
One question is about this inspiratory exercises. Is it done through some machine, or is it like the patient can do it himself?
No, there are specific techniques, specific way of breathing that are told by respiratory therapists. They are not done through machine. There are specific exercises that are for inspiratory muscles.
Right.
So, who will repeat the clinical features that are specific for bronchiectasis in one line? Dr. Malia, can you please tell us what are the clinical features of bronchiectasis that you should look for in the exam? Dr. Malia, are you there? Okay, Dr. Shafraz, can you please tell us?
Yeah, sure. It is a persistent cough with purulent, copious sputum production.
Yes, copious sputum production. Copious is the word that is associated with bronchiectasis. So, what will you find on clinical examination in a patient with bronchiectasis?
I think there would be large airway rhonchi and maybe a wheeze.
So, inspiratory crackles and rhonchi or wheeze may be present on clinical examination. That's right. Excellent. Initial investigation will be chest X-ray, and definitive investigation will be diagnostic investigation will be HRCT. On HRCT or X-ray, we'll see signet ring sign, Dramblin cysts.